Rickets versus scurvy. Rickets and scurvy are both nutritional deficiencies but differ in their root causes, targeted vitamins, and symptoms. Rickets, caused by vitamin D deficiency, scurvy, caused by vitamin C deficiency. Stay to the end to see which disease has caused more morbidity and mortality. Rickets was especially common among children during the 19th and early 20th centuries in industrial cities where sunlight, essential for vitamin D synthesis, was scarce. The disease significantly declined in prevalence with the advent of food fortification, particularly the fortification of milk with vitamin D, in the early 20th century. Scurvy has a long history and was a severe issue for sailors during long sea voyages, well into the 18th century. British naval surgeon James Lind was instrumental in discovering that citrus fruits were an effective cure, which eventually led to British sailors being issued lemon or lime juice, earning them the nickname, limeys. Historical figure. The famous explorer James Cook was noted for virtually eliminating scurvy among his crew by insisting on a diet that included fresh fruits and vegetables. Rickets is primarily caused by a deficiency in vitamin D, which is essential for calcium and phosphorus absorption in the gastrointestinal tract. Foods like milk, fish, and eggs are rich sources of vitamin D. Lack of this vitamin results in decreased absorption of calcium and phosphorus, and high doses of glucocorticoids can also inhibit calcium absorption in a vitamin D-dependent manner. Scurvy, in contrast, is caused by a deficiency in vitamin C, necessary for collagen synthesis. Citrus fruits, tomatoes, and green leafy vegetables are typical sources. After 1 to 3 months of inadequate vitamin C levels, scurvy leads to a myriad of different symptoms, including anemia, myalgia, bone pain, easy bruising, swelling, hemorrhages, corkscrew hairs, gum disease and gum bleeding, poor wound healing, mood changes, and depression. Patient scenarios. Case: vitamin D deficiency in a child. A 3-year-old patient shows bowing of the legs. X-rays confirm widening, cupping, and fraying in the metaphyseal regions, leading to a rickets diagnosis. Treatment involves vitamin D supplements and dietary changes. Case: vitamin C deficiency in an adult. A 45-year-old patient presents with fatigue, joint pain, and swollen, bleeding gums. Low vitamin C levels and blood tests confirm a scurvy diagnosis, and the treatment includes vitamin C supplements and dietary changes. 1. Rickets affects up to 1 in 1,000 children in some developing countries. 2. Scurvy affects approximately 1 in 20,000 people in developed nations. Comparing the historical impact of rickets and scurvy is challenging due to variations in record-keeping, affected populations, and geographic spread. However, it can be generally stated that scurvy had a significant impact on sailors and explorers from the 15th to the 18th centuries, causing many deaths on long voyages. Rickets, on the other hand, was more widespread among the general population, particularly in industrialized cities, but was less often fatal if treated. Scurvy affected a high percentage of sailors on long voyages, with estimates suggesting that nearly 2 million sailors died from scurvy between the years 1500–1800. Rickets. Data on the global prevalence is less precise, but it was a common condition, especially among children in urban areas during the 19th and early 20th centuries. In summary, while rickets may have affected more people overall due to its presence in broader communities, scurvy had a higher mortality rate, particularly affecting sailors and explorers before the 19th century. For additional insights into rickets and scurvy, you can consult the CDC's nutrition report.